Now we'll begin our discussion of venous system disorders. We'll start with venous varices. Varices are dilated, tortuous veins that are caused by increased intraluminal pressure that may be secondary to venous valve incompetence, such as the typical varicose veins that you'll see in patients' legs, hepatic portal hypertension, which will lead to esophageal varices, and constipation and pregnancy, which can lead to anorectal varices, otherwise known as hemorrhoids. Varicose veins cause lower extremity edema, stasis dermatitis, and potentially skin ulcers, and increases the risk for thrombosis. Here's a picture on the right there of typical varicosities in the lower extremities. So esophageal varices are common in patients with hepatic cirrhosis from whatever etiology, whether it be chronic hepatitis C, alcoholic cirrhosis, or any other etiology. These can cause life-threatening hemorrhage when they bleed and require emergent endoscopy to correct. And again, they're secondary to the portal hypertension that's a byproduct of the cirrhosis. Anorectal varices cause bleeding. Occasionally can be serious. This is bright red blood per rectum, and it puts you at increased risk for thrombosis. Hemorrhoids are incredibly painful and not an unusual complaint presenting to the emergency room or our clinics. Deep venous thrombosis, or DVTs, are thrombosis in vessels that occur in the setting of what we call Virchow's triad. So when there's venous stasis and hypercoagulable state and vessel wall injury, this is kind of the perfect storm to create DVTs. Risk factors for DVTs include pregnancy, cancer, both of which make you hypercoagulable, inactivity, which contributes to the stasis portion of Virchow's triad, and postoperative states, which does both, in addition to varicose veins, which causes venous stasis due to the varicosities in the lower extremities. Here's a cartoon drawing of the various layers of your typical blood vessel extending from the endothelium outward, and you can appreciate the cartoon thrombus in the middle of it that is developed. So what is required typically for DVTs to form is a combination of those three things we mentioned in Virchow's triad. So some type of stasis in combination with some type of endothelial wall injury, and patients that have, for whatever reason, a hypercoagulable state are at increased risk for these. Clinically, you get pain and swelling in the calf. You can feel a palpable cord. You can have a positive Homan sign, which is essentially pain, calf pain with dorsiflexion of the foot. An acute complication of DVT is pulmonary embolism. Chronic complications of DVT can be stasis dermatitis or varicosities in the lower legs as well. Vascular tumors include hemangiomas. In general, you have a localized increase in the number of vessels causing these tumors, and the vessels are abnormally dilated. Capillary hemangiomas are subcutaneous, seen in the skin or mucous membranes, and they're small, bright red or blue lesions. Here is an example of a capillary hemangioma of the tongue. Cavernous hemangiomas are visceral masses consisting of large dilated vascular channels seen in often tested but relatively rare von Hippel-Lindau disease. It's found in the brain, liver, and pancreas and other organs as well. Here is a slide of a cavernous hemangioma, and you can appreciate the large cavernous vascular spaces that you see there. You can also have simple lymphangiomas. These are masses composed of small lymphatic channels seen subcutaneously in the head, neck, or axilla. You can have the cavernous lymphangioma or cystic hygroma. These occur in the neck and axilla of children and become incredibly large. They're massively dilated cystic spaces that are lined by endothelial cells. These are associated with Turner syndrome. Malignant tumors of the vasculature include Kaposi sarcoma, which is caused by human herpes virus 8 in immunocompromised patients and manifests as red-purple subcutaneous macules. Angiosarcomas are most common in the liver, otherwise known as hepatic angiosarcomas. They're associated with arsenic, polyvinyl chloride, and thoratrast or radioactive contrast. And that concludes our session.